I'm a professor of internal medicine at Wake Forest School of Medicine and the faculty director of the Digital Communication Core. The DCOMM shared resource was created to give clinical and research programs access to a HIPAA-compliant text messaging solution. Specifically, DCOMM manages a HIPAA-compliant telecommunications platform provided by Twilio, a leading customer engagement company. Using DCOMM's Twilio account, you can deliver automated text messages to patients that meet federal HIPAA requirements. You can also use the platform for chatbots or interactive voice response calls. If you have experience with text messaging programs, you may have heard of Twilio, and you may even have your own account. However, it is important to know that the free accounts you can get from Twilio are not HIPAA compliant. For this reason, Atrium Health Wake Forest Baptist requires any research project that is sending automated text messages to use the DCOMM Twilio account. DCOMM launched in May 2020. It is administered by the Center for Healthcare Innovation and receives support from Wake Forest, the Center for Healthcare Innovation, and our Cancer Center. Over a dozen text messaging products are using the service. These range from studies that are sending text message reminders to participants about upcoming study visits, text messages that are sending out surveys, text messages that encourage a behavior change, or clinical surveys to gather additional health data prior to an appointment. DCOMM is really designed for programs that are sending automated text messages. If you instead want to use texting for real-time two-way communication with research participants, then DCOMM is likely not for you. Instead, a study cell phone or some other program would be your best solution. If you want to send automated messages, you can apply to use DCOMM's service using the red cap link here or scanning this QR code. DCOMM has a governance committee that meets once a month to review submitted projects to ensure they meet all federal and institutional requirements. Once approved, our team issues the project a token that gives them access to DCOMM's Twilio service. The DCOMM Governance Committee also reviews requests to use MyChart or MyWake Health message campaigns for patient or participant outreach in the Atrium Health Wake Forest Baptist region. You would use the same REDCap application form for MyChart project requests. One important point to note is that DCOMM is providing access to the Twilio platform, but the study team or clinical operations team will still need to program the text messages that are to be delivered. Using REDCap is often the simplest solution. DCOMM charges a one-time account setup fee and a monthly fee to cover the cost of the Twilio service. Institutional subsidies are available for pilot studies and other smaller projects. If you have any questions about the DCOMM service, feel free to reach out to the DCOMM project manager, Elena Wright.